You know that feeling when the world just loses its sharp edges? That little blur that makes you squint, whether you're trying to read a book or make out a sign way down the road? It's something so many of us experience, and honestly, it often comes down to just a few usual suspects. So let's get into it and bring your world back into focus. So why do things look out of focus? It seems like a simple question, right? But the answer can be pretty interesting. Is it a problem with the eye itself, or is something else going on entirely? That fuzzy, unclear world is something a lot of people deal with, and figuring out the why is really the first step to seeing clearly again. And yeah, this is exactly what we're talking about. That kind of frustrating, soft, out-of-focus view is often the work of one of three very common conditions. We're going to break them all down one by one so you can really get what might be happening behind your eyes. All right, here's our roadmap. First, we're going to talk about a fascinating brain-eye mix-up called amblyopia. Then, we'll get into the nitty-gritty of an imperfect lens with astigmatism. After that, we'll tackle the focusing challenges of hyperopia. And to wrap it all up, we'll bring everything together so it's all crystal clear. Okay, first up, amblyopia. Now, you might think vision is all about what your eyes are doing, but this condition is the perfect example of how your brain is the real boss. It's actually less of an eye problem and more of a communication breakdown between your brain and one of your eyes. So here's the deal with what people call lazy eye. The core issue is that nerve pathway. For whatever reason, it's not working right. So the brain, being efficient, just starts to, ignore the signals from that weaker eye. It starts to rely almost completely on the stronger one. So the eye itself isn't lazy, it's just that the brain isn't really using it. So what does this actually look like in real life? Well, you might notice one eye that seems to wander or drift on its own, or maybe you find you're really bad at judging distances, like, is that step closer than it looks? Big one. You might find yourself squinting a lot or even closing one eye to try and get a sharper image. These are all little clues that your brain is playing favorites. But here's the really good news. It's totally treatable, especially if it's caught early. The treatments are all about forcing the brain to pay attention to that weaker eye again. Things like putting an eye patch over the stronger eye, using special eye drops, or getting the right glasses. All right, next up, we've got astigmatism. And this one is all about the hardware of your eye. I want you to imagine your eye is like a super high-tech camera. Now, for a perfect, crisp picture, the lens has to be perfectly smooth and curved, right? Well, with astigmatism, that lens is shaped a little more like a football than a basketball. So, because that lens has an irregular shape, it can't focus light into a single sharp point on your retina, which is like the film or the sensor at the back of the camera. Instead of one perfect focal point, you get multiple, and everything gets kind of scattered. This is what causes things to look blurry or distorted, and it doesn't matter if they're up close or far away. And all that constant effort your eyes are making to try and focus, that's what leads to eye strain and headaches. And that part about trouble driving at night? Oh yeah, that's a classic sign. The glare from headlights can look streaky or like a starburst, which makes seeing clearly at night really, really tough. The great thing is, this is a very solvable problem. Special glasses or something called toric contact lenses are designed to counteract that irregular curve in your eye, and they bend the light back into sharp focus. And of course, for a more permanent solution, there's refractive surgery that can actually reshape your cornea. Our third and final condition is hyperopia. You've probably heard of this one, but maybe by its more common name, farsightedness. And just like the name suggests, it's all about what you can see clearly and what you can't. Okay, let me break this down. Think of your retina as a movie screen. In a perfect eye, the light focuses right on the screen, giving you a sharp image. With hyperopia, the eyeball is a little bit too short, front to back, so the light actually tries to focus behind the screen. It's like the projector is too far back. This is why things far away can look perfectly clear, but anything up close is a blurry mess. And this comparison right here, it just says it all, doesn't it? On the left, a nice, crisp letter. On the right, that familiar, frustrating blur you get when you try to read something on your phone or in a book. It's the perfect visual for that daily struggle. So all the symptoms, they really come from your eyes just working way too hard to see things up close. That constant squinting, the headaches you get from eye strain, even a burning or aching feeling after you've been reading for a while, that's your eyes just screaming for a break because they're trying to pull that focus point forward. And just like the others we've talked about, the solutions are super effective and easy to find.
Corrective lenses like reading glasses or contacts do the work for your eye, bending the light so it lands perfectly on the retina. And yep, refractive surgery is also an option here to permanently correct the eye's focus.
All right, we've gone through a lot, right? A brain-eye mix-up, an imperfect lens, and a focusing error. Let's pull all this info together and get one single, crystal-clear picture of what's going on. Think of this table as your quick cheat sheet. It's all about the what and the why. For amblyopia, what's blurry is one eye, and why is that brain-eye communication problem. For astigmatism, what's blurry is, well, everything, and why is that uneven focus. And for hyperopia, what's blurry is stuff up close, and why is because the image is focusing behind your retina. Simple as that. So now you can spot the signs, but what's the most important thing to take away from all of this? It's that blurry vision is not just something you have to put up with. Understanding the cause is the absolute key to finding a solution.